Unlike the United States, some countries offer free or low-cost healthcare to everyone. This being part of why the United States has the highest healthcare costs of 8 nations. The government should play a stronger role of controlling costs and negotiating prices for healthcare and prescriptions in our country. Medical care prices in the United States increased a total of 49% in 2016, states the Bureau of Labor Statistics. Premiums under Obamacare's second lowest costing plan, known as the Silver Plan, rose by 7.5%. According to eHealth Insurance, unsubsidized customers having the individual coverage plans paid an average of $350 per month in premiums, while having a $4,500 deductible. Family plans averaged $850 a month, with deductibles being around $8,000. Many of the high-cost unsubsidized health plans also have many stipulations with those plans. These stipulations include strict rules of what doctors are in network, what procedures and medicine is covered, and a lot of these healthcare plans don't cover basic or routine visits, nor do they cover daily medicines. Several things contribute to the high cost of health insurance, and all things medically related. A small portion of why the United States healthcare is so much more cost prohibitive than other countries is the increased amount of administrative costs. Annually, $361 billion, or 14% of all healthcare expenditures, is consumed by administrative costs in the healthcare system. If we could expand high-tech certifications for electronic health records to include administrative provisions, the annual savings from this alone could be $4.2 billion. Along with administrative costs, amounts billed to insurance companies are significantly higher than those billed to cash patients, as discounts are often offered to cash patients for non-insured patients. On average, insurance companies are billed 20 to 50% higher than individuals. These inflated amounts being sent to insurance companies ultimately increases the amount they pay, which in return raises the cost to be insured. It is also tremendously easier and more common for doctors to be sued in the United States. A 2010 study reviewed by Archives of Internal Medicine found 90% of the 1,231 physicians surveyed stated the doctors ordered more tests and procedures than are actually needed for the patient to proactively protect themselves from any sort of litigation, which creates more administrative work and more money owed to the doctors. Many of our pharmaceutical companies have put a large inflation on life-saving medicine. Mylan, the company who purchased the producing company of the EpiPen, put a $600 increase on the life-saving pen. This 500% increase led to a $300 million pay increase for Mylan executives. On average, standard medicines have a profit margin of 20%, while generic medicines' profits are even greater at 50 to 300%. The Congressional Budget Office found that providing low-income beneficiaries of Medicare Part D with the same discount Medicaid recipients get, the federal government would save $116 billion over 10 years. This is just a small portion of savings that can be enforced and contributed to new laws to control inflation. Capping the cost of the doctors and pharmaceutical companies and what they can charge will ultimately lower the cost of Medicare and Medicaid, are what they're being billed for each patient, thus just adding to the savings for not only the government but citizens as well. Most other developed countries have government controls in place for healthcare. These governments have the ability to negotiate lower drugs, medical equipment, and hospital costs. Government controls can avoid big pharmaceutical and insurance companies inflating the cost of these necessities to the citizens of our country, which then contributes to Medicaid and Medicare savings for the government, as well as more people being able to afford to be insured and getting medical attention when needed. Let's fight for our government to fight for us and build a better future for the health of us all.
Right on.